Hi.
Hey, how are you?
Good. You can hear me?
I hear you. You're
All
great.
right.
Amazing. Thank you for joining us today to speak a little bit about the incredible research that you're doing with RISE. Before we jump in to learn more, do you want to take a minute and just introduce yourself to the HTICPA community?
Absolutely. So, hi everyone, and thank you, Gila and Yesh Tikva, for having me on your account. So, my name is Odelya Kaufman. I am a clinical genetics doctor and a research scientist at Yale. And as Gila mentioned, I'd like to tell you guys about a research study we're working on at Yale called RISE, which loosely stands for Recurrent Pregnancy Loss Investigational Studies.
Amazing.
So I'll just dive in a little if that's
Sure.
great.
Can you start by just explaining to us a little bit about why you're doing this research and what you're researching specifically?
Yeah.
Amazing.
So first of all, let me just start by saying that my clinical realm of expertise is in pediatric genetics. So I'm not an OB doctor, but I am very interested in, the women's different struggles with infertility, and kind of how early embryonic development plays into that. So before I kind of explain a little bit about this study, I thought I would talk about what recurrent pregnancy loss means in the clinical world. So I think, probably many of us are somewhat familiar with the fact that miscarriage is actually a pretty common condition. It does occur in about 1/5 of pregnancies. And most of the time this is random, it doesn't mean that there is an underlying issue. But recurrent pregnancy loss, which means 2 or more pregnancy losses, is a lot less common. And according to the American College of Obstetricians and Gynecologists, it actually only affects 1% of women. So that's somewhat surprising, yeah. And there's a normal process when a woman has had recurrent pregnancy loss for evaluation with the OB doctor. And they're going to look into several different possible reasons why someone's having recurrent pregnancy loss. One of the things they would look into is if there are any kind of issues with the uterus. For example, if there's fibroids or polyps in the uterus, or there can be scar tissue in the uterus, or sometimes people are born with a slightly different shape to their uterus, and those can all be contributing factors. Other things that can contribute are if someone has hormone issues, like if they're maybe have not well-controlled diabetes, for example, or thyroid issues. There's an autoimmune condition called antiphospholipid syndrome, which can cause blood clotting, which when it affects the placenta can cause recurrent pregnancy loss. And so these are all the kind of things that the doctors would look into to see if there's an underlying reason for the pregnancy loss. And if possible, another thing that the doctor might do is to do genetic testing on the fetus, because many pregnancy losses, as we know, maybe almost half of them are caused by missing or extra chromosomes in the fetus, something called aneuploidy. Any questions about that so far?
Yes, you had mentioned about recurrent pregnancy loss being 2 or more losses.
Yeah.
Must they be consecutive to be considered recurrent pregnancy loss, or one could have a pregnancy loss and then go on to carry a pregnancy to term and then experience another loss after?
Good question. There's no rule about the pregnancy losses being consecutive. And I should say that this can be a loss that's, just confirmed by a pregnancy test, like a blood or home pregnancy test, or even a loss that's been confirmed after an ultrasound. So despite doing, all these kind of clinical tests, over half of the time, doctors don't find, a reason like a problem with the uterus or aneuploidy in the fetus that is causing the recurrent pregnancy loss. And so the purpose of this research study is to see if there are genetic conditions that, other than aneuploidy, that can be contributing to recurrent pregnancy loss.
And when you say genetic reasons, there are genetic reasons both in the fetus and in the woman.
Yes, exactly. And I'll kind of explain a little bit about how the study is looking at those things.
Amazing.
So I think, many women who are trying to get pregnant or thinking about getting pregnant might be familiar with a type of genetic test called carrier screening that you'll get in your OB's office. And like the biggest, most comprehensive carrier screens are usually about 200 to 300 genes, looking at 200 to 300 genetic conditions that can cause a genetic condition in the child if both parents are carriers for those conditions. But actually, I think what some people don't realize that outside of those 200 or 300 genes, there's actually many, many thousands of other genes that we know of that can cause disease. There's in fact 20,000 genes in the human genome. Yeah. We only know what about 5,000 to 7,000 of those genes are actually doing. In terms
so
of
there's still research on the remaining. Wow.
Yeah, and even even within the ones that we know that cause human disease, those 5,000 to 7,000 that we know of, there's still a lot that we don't know about those. And of course there's the other 13,000 genes that we don't really know exactly how or if they contribute to human disorders. Wow. So, and that kind of, if you think about it, the human genome was only fully sequenced in 2003. So it's been just a little bit over 20 years since we've had all of this information, and there's a lot to learn, and we're learning it quickly, but of course there's always more to know. So the RISE study is using a type of genetic test called whole genome sequencing. Okay. And that's a sort of test where we do basically the equivalent of like a spell check on all of these 20,000 genes. Wow. Because our genes are written in like a letter code. So we're doing a spell check to kind of look at all these 20,000 different genes. And we do this on the fetal DNA as well as the, mom and dad's DNA. Wow. And so kind of the sort of first step of the study is to look at a handful of genes that we know of already have been published that we know cause recurrent pregnancy loss. And
how many genes have already been published cause recurrent pregnancy loss?
So there's 7 genes with very conclusive evidence. It's not very much.
And is there yet any treatment available for those who carry those 7 genes?
That's a good question. There's not like a specific treatment per se. It's more knowing about it. And if, depending on the genetic cause, you might be able to, screen for the genetic cause of the pregnancy loss using IVF. Oh. Yeah. So yeah, there's not a specific treatment yet.
And so if you're studying to see if there are additional genes.
Right. Yeah. So if we find something on those 7 genes, then we'll inform the study participants about their genetic testing results, and they can take that back to their doctors, and like I said, consider doing IVF if that's necessary. But if we don't find anything in those 7 genes, which most of the time we don't, then we kind of look at the rest of our other 20,000 genes. And we're looking at any kind of spelling changes that we are suspicious for in, different genes that might be contributing. Wow. So, yeah, as you were mentioning before, there's kind of two angles to this. One is the angle of the fetus, and the other is the angle of the mom's DNA. Right. So from kind of the fetus side of things, we're looking for any genetic changes in genes that we know of or we think could possibly be really important for survival of the embryo or the fetus in some way. Like, for example, genes that are involved in development of the blood vessels or the heart, or like very critical areas of the brain, or something like that.
Wow. I'm going to ask a question on this. I know that you mentioned that a recurrent pregnancy loss is any pregnancy that's tested through a home pregnancy test or a blood test, or even one that is detected on ultrasound. How far along in a pregnancy must a fetus be to be tested, and how do you make sure that you have what you need to test?
For like the sample, you mean?
Yes.
So there's no minimum requirement, but of course, like the earlier it happens in the pregnancy, the less likely it is that we'll find something that's testable for DNA. Technically speaking, the study really goes up to 21 weeks in gestational age, and actually a recent change to our study protocol is that we're no longer requiring participants to have like a testable sample of fetal DNA, and that can come from something that was a recent pregnancy, or even what we call like an archived sample. Like, for example, if you had a pregnancy loss a long time ago and the pathologist checked the placenta, then they'll probably store a little piece of it in their kind of slides, and then we can later extract DNA from that. So, but we're no longer requiring any sample at all. If you just have a history of recurrent pregnancy loss, we can enroll basically just the mother and check just the mother's DNA for kind of the mom's side of the DNA analysis.
Because it sounds like from what you're describing, in order to get a sample, essentially one would need to have had a DNC to have tissue sample available to test.
Yeah, I mean, technically some patients do try to collect samples from home, but that's not usually very efficient. So yeah, like you said.
Are there special, I mean, I would assume that in the trauma of experiencing the loss, it might be very difficult to collect. But for those who are seeking answers and want to collect and want to go through that process, are there any tips that you can suggest on the most effective way to capture usable, testable?
I actually don't have that expertise. I think it would have to, come from the OB doctor that's helping them enroll into this study.
And it sounds like you're working together with OBs to enroll.
Yeah, so this is definitely like a collaboration between clinical geneticists such as myself and OB doctors, REI or reproductive endocrinology doctors, and basically various subspecialties of OB, and scientists that are kind of experts at looking at these different spelling changes or genetic changes. And it's a huge group of, I think, probably 60 different collaborators that are most of us at Yale, but there's many other kind of university-based hospital sites that are all over the country that are part of this study. Like we have Columbia in New York City, Johns Hopkins in Baltimore, Northwestern and UChicago, I believe, Penn State, Colorado, UT Austin and UT San Antonio, Wayne State in Detroit, and Utah is also a recently joined site. And even if you're like not living close to one of these particular medical centers, you could potentially join the study because we are basically enrolling patients by speaking with them on the phone or having kind of like a video visit, and then you can send in a sample, like in the mail, it would be like a saliva sample. So so it's coordinated through these different medical centers. But people all over the U.S. are kind of able and encouraged to participate if they're interested.
So if I'm someone listening to this and I would want to be able to send in my sample to be tested, what are the steps I would need to take to sign up? Assuming I'm not affiliated with one of these medical professionals who have informed me of it.
Yeah, I mean, even if you're, a patient in one of these sites, the best way to go to get enrolled would be to go to our website, which is risepregnancyloss.org.
Okay.
And through the website there, you can, read about the study, and you can click the Join Our Study button, and that doesn't like commit you immediately to joining the study. It will just mean that one of the study coordinators will contact you. They'll call you, talk to you, and make sure, that you understand the risks and benefits and are eligible, and then they can enroll you into the study.
Wonderful. And you had mentioned this a little earlier, but to clarify, you had said that if results are found that someone is a carrier for one of the 7 known genetic components to recurrent pregnancy loss, you will let them know. But if they're not, do they still get information, or I understand that in most research participants, don't receive any information.
That's a totally good and legitimate question. For the most part, the answer to that is it won't be an immediate kind of feedback. So when we're finding things on a research basis, there's sort of, rules about what we can tell people relating to their genetics and how it causes disease. And we can't tell people that they have a genetic change unless we're very certain that it causes a disorder, and we can't be very certain until we've done a certain amount of legwork. Usually we have to identify it in 2 unrelated families to be absolutely sure that this is the cause. So there's not an instant gratification on the research end, unfortunately. I know that's frustrating.
But still furthering the science and what we will know, and hopefully help many, many women along this journey.
Yeah, absolutely. I know it's a really, difficult experience for the women that are going through this. There's so much frustration and lack of answers. And, in a way, this is kind of, sure, there's a chance that you might get some answers yourself, but this is kind of an investment in our future and the future of women's health that maybe a few years from now we'll be able to give women who are going through similar experiences more answers than we have now, and that's really the hope.
It really is amazing that you're doing this, and how research really does build and over time create more answers. And even as we've seen in the course of fertility treatments available today, the growth that came over the last 40 years has been incredible, and can only imagine that with this added research, that continued growth will continue to impact those dreaming of growing their families very positively. So thank you.
Yeah, we hope so.
Yeah. Are there any last thoughts that you'd want to leave the Ishikva community with today?
No, just, as I said before, if anyone's kind of interested in learning more, the website is a good resource. That's risepregnancyloss.org. And I don't know if you can tell if there are questions anywhere in the chat, or
no one's posted any questions today.
Okay.
But you've done an amazing job explaining the research project. And we will make sure to tag you. And I see that your handle is the same as the website.
Yes.
So anyone can type in the risepregnancyloss.org, learn more, or they can DM us and we'll send them your way, or connect directly with you on Instagram to receive more information.
Sounds good. And we also have an email which isn't as closely monitored, but that's rise@yale.edu if anyone wants to shoot us a question.
Amazing. And if people have questions that haven't yet been answered, they're welcome to drop it in comments on the live after. Amazing.
Thank you, Gila.
Thank you so much.
Bye.
Have a great day.
Take care, everyone.